All right, and we are live. So, um, for the people who didn't see all the different notes and whatnot that we put out there, this is we're doing a very interesting interview today with Vita Ziliak, which I definitely didn't get that right, but close enough. She is a myofunctional therapist, and if you're like me 2 months ago, you're probably wondering, what does that even mean? So we're going to get into that and why I think it's so I think it's underrated for sure, and why if you're dealing with sleep apnea or oral facial pain like TMJ, this can really be a game changer, and it's a shame that more people don't know about it. So what I want to start with here with Vita is just with your story, because I think that will help people understand what brought you to this, and the value that it can provide. So if you can, just give a little background about what brought you to myofunctional therapy, and why you do what you do.
Yes, definitely. So, my name is Vita. I'm the owner of Maya Vita. I'm a myofunctional therapist with the background in dentistry. So, I'm a licensed dental hygienist. And I worked as a dental hygienist for almost 13 years to try to figure out how I can help myself with my jaw pain, the jaw pain I had for almost like 15 years, chronic jaw pain. And it all started, my personal battle started when I was little with sleep issues. I always had sleep issues. I don't remember a day in my life when I was a kid and I didn't wake up tired, or I wasn't sleepwalking, sleep talking, bad dreams, nightmares, hyperactive in school. So that child with all of those sleep issues grew into becoming an adult with sleep apnea. And later in life, that all caused even more issues because many people who have sleep apnea, they also have underlying jaw pain. So there's like a jaw pain that comes with it. And so later in life, that caused, I started to experience jaw clicking and popping with migraines because during sleep, I was grinding, trying to open up that airway to breathe, which I couldn't. So um, all that, all that chronic jaw pain, all that sleep issues led me to look into more holistic, naturopathic blood work and trying to figure out what was wrong with me. And I finally, 4 years ago, when pandemic started, because many people had a lot of plenty time on during the pandemic when everything closed. So when the pandemic started, I looked into myofunctional therapy and I was like, oh my God, it's all about the muscles. Why people are not looking about the muscles, why, how they're functioning. And that changed my whole life. And I was, just like you said, I was so surprised that not everyone is talking about it. People should be talking about our muscles. Like just like we go to the gym and we exercise, right? To try to train our muscles to get them stronger. It's the same with our face, head, and neck. Like we don't even think about it, right? But our muscles are very important in our overall health because if you have pain anywhere about this area, right, it will affect your whole life, and you're not going to be able to thrive and do what you need to do daily. So yeah, definitely.
What is where does this originate from? Because I think for a lot of people, um, say they have sleep apnea, they have like TMJ, they have some facial pain. Why? What is going on with the musculature? Why is
Yeah,
it out of whack, and where is it coming from?
I'm trying to get a pencil so I can show. So the thing is that everyone goes to a dental office for like every 6 months, right? And many people started to grind their teeth. Many people get to a dental office and they're like, or the dentist be like, you grind your teeth, you should get an eye guard. And now, since 2017, dentists started to look and screen people for sleep apnea. That's why if now you go to a dental office, they'd be like, okay, we are screening for sleep apnea right now, and you do grind your teeth, your tongue is very big, and it may be closing your airway. And they start asking questions. Do you snore? Do you wake up tired? How do you feel during the day? And all those kind of things. And patients start to look at the dentist and like, no one ever asked me that before. You never asked me before. I've been coming here for the last 10 years. What's happening? And it's because we started to realize that the facial complex is more complex than it is. So I like to show the diaphragm. I don't know, John, can you see it well?
Yep. Yeah, looks good.
Yeah. So So it's a perfect diaphragm. So this is our nose. This is our roof of our mouth, which is our palate. That's our tongue. So our tongue is a very big organ, right? And those are lips, right? So our lips should be closed in the normal world, and that's what a myofunctional therapist teaches is to keep your lips closed, to breathe with your nose, and have that tongue up on the roof of the mouth. Because if the tongue is up on the roof of the mouth like this, that indicates that you can breathe properly with your nose. But if the tongue stays low, you're not going to be able to breathe with your nose. And what happens is, so if you go from a picture like this is a perfect structure. This is what normal should look like, lips closed, perfect space for the nose, that tongue up, and nothing blocks that airway, right? Because if we are sleeping by gravity, everything goes back. Your soft palate goes back, your tongue goes back, and then it starts to suffocate. And what happens is the body's like, I need oxygen, give me oxygen. I can't breathe, give me oxygen. So what it does, the first thing, it sends a signal to your lower jaw to bring the lower jaw forward like this. So you go from here to like this. It brings it forward to open up the throat, right? To get the tongue, to push the tongue out of the throat so you able to breathe, right? And if that fails, what happens is then it's like, okay, so that didn't work. I made the body grind the teeth, right? And that's why people grind their teeth. It's not because back in the day we were like, oh, it's just stress, it's just stress. Here's a night guard, wear this and to protect your teeth. And then many people come home when they wear that thing and their sleep is worse, or they will wake up and the night guard will be on the side of their bed. And they're like, I can't wear this thing. I suffocate with this thing. There's a reason why, because the body needs oxygen. The body will push it out, the night guard out of the mouth, or wake them up because it needs that oxygen. So the first thing, it will try to push that tongue out of your throat. And if that doesn't work, the next thing it does is starts to pump more blood to your heart. So it starts it gets your heart going. So you will wake up because it needs oxygen. It's like, wake up, you have to wake up, you have to breathe, because otherwise the brain is not getting oxygen. I may die, right? So what happens is a person will wake up kind of like after a nightmare or anxiety, or they will wake up and be like, oh my God, I need to use the restroom. They go to the restroom and they go back to sleep, right? And those are all signs of sleep issues. And even though it may not be sleep apnea now, it may cause sleep apnea later, like in 5, 10, 15, 20 years. So a lot of more people are more aware of it. A lot of more people started to screen. That's why everywhere, like if you look TV now, you can see all these different devices for sleep. Sleep aids, like make your sleep better, do this, do that. So it's more out there. But myofunctional therapy has been out there for like over 100 years. It's just more live stream now. Like people are more aware of it because of social media, because of whatever we do now, right? Like we will get more people understand what it is and how it can benefit them, right?
So when this happens, like say people have you say their tongue is fat, they have poor facial structure. Is this coming from, is it mostly like childhood that this is originating? Is
Yes.
it, and if so, like what's wrong? What are we doing wrong in childhood that we should be doing differently?
So it's not just that, it's also our environment plays a big role, our genetics. Yes. So like if you look at my face, I have a very small mouth, I have a very small jaw, very small mouth, I have few teeth missing that just never came in, because that's how my genetics background is, right? So when that happens, I was already predisposed to having some sleep issues, right? So if my mom, and back in the day, this was not available, like especially in a different country, right? But in America right now, what they do is they take the babies, right, and they screen them with the airway focused dentist, and they check for a tongue tie, because if there is a tongue tie, the tongue cannot stay up on the roof of the mouth, and our tongue is actually shapes the roof of our mouth. So our tongue should be fully up on that palate, right? So if the tongue is not fully up, what happens? The roof of the mouth changes and it becomes that V shape. So instead of being flat, it becomes like this. So the roof of our mouth is the floor of our nose. So if the roof of our mouth is like that, look at the nose. There's no room for the nose. And that's when people get deviated septum. I have deviated septum. If you look at it, I never had anything with my nose. Like if you look at it, the nose looks straight. But because my mouth is so tiny, right? Because of my genetic, like what happened when I was little, right? Because it's like this, and my tongue never even had a chance to stay there. And I am also tongue tied. So that's a tongue tie, right? So I'm also tongue tied. So I didn't like if no one back in the day, no one caught it on time, right? That I had it, that all caused all the changes in my facial structure. We should be wider here. We should not go this way. So if you look at my face kind of goes this way. And also our face has to go like a straight line. So it should be straight like this. So you can tell, you can see how deficient I am if I go by my ruler. So you see? So I should be like this
Mm.
to be able to breathe. That's why I have sleep apnea, right? And so that could be like if how we can, it all starts in early childhood. Like it all starts how you were born, what happened during birth, your genetics, tongue tie, if there was an ability to breastfeed, if there was breastfeeding or no breastfeeding, enlarged tonsils and adenoids. Some children are born with big adenoids. I have a friend whose daughter was just born with big adenoids, and she was waiting until she was 2 to remove those adenoids because she knew that it would change her facial structure. And her adenoids were just so big. There's no way they could treat it naturally, right? Or with even with steroids to get them smaller. And the other thing is lack of chewing foods. Like we don't chew anymore. Everything is soft. Like even if you think about granola, it's soft. It's not that crunchy. Everything is soft and everything is carbs. There's no that chew. You're not engaging those chewing muscles. You're not chewing that beef stick or beef jerky, right? Like back in the day, kids used to do that. So it is changing though. It's like there's more awareness right now and it's changing. They're removing all of the bad pacifiers. They're getting the bottles better for the kids to make sure that they're growing wider. Instead of this way, they're growing this way. So there are a lot of things right now that they're educating parents more. There's more awareness right now.
Yeah, this is one thing we talked about before, like the book Jaws, and that's something that I learned as well was the mechanical force of chewing, of like, back in the day we're chewing on like bones and whatnot that has a
Yeah.
lot of resistance or tough meats. That helps your face develop as a child. And like you said, now it's like everything is like pureed. It's like, oh, I'll give my kids applesauce or yogurt or something, but there's nothing that gives them that mechanical stress for the face to develop. And that's where you start getting a lot of issues. So that's really cool.
Yeah,
When
definitely.
you mentioned bad pacifier, what's a bad versus a good pacifier?
So I nanny pacifier is like the best one. If anyone has questions about pacifiers, they can like message me and I will send them links. I don't see babies or little kids, so I refer them out to local occupational therapists and they help guide them the right way. Nanny pacifier is like the best pacifier on the market. Nanny or Nini. So that one is like the best one. So it's a shape of a nipple. So and it shapes the roof of the mouth properly. So when the baby is sucking on the pacifier, the tongue does that movement just like with breastfeeding. Because whenever the baby, if the baby is able to breastfeed, the tongue does this. And when it does this, it comes down the nervous system and it also massages that roof of the mouth, which is our palate. And that actually massages our brain, interestingly. In CFT and craniosacral fascia therapy, they talk about how our tongue, whenever it gets on the roof of the mouth and it does this movement, it activates your brain cycles and make them flow easily, which is pretty amazing. There's so much research right now going on around that. Yeah.
That's cool. Yeah, I'm very curious. This is purely selfish because I have a 6-month-old. So that's one thing I remember hearing you say. I was like, I wonder what a good versus bad one is. Because yeah, I mean, how often are kids there
Yeah,
with a pacifier in their mouth, and you're not even thinking about how this is affecting their facial development and how can it lead to sleep issues down the
yeah,
line and pain and whatnot.
yeah. Well, by 6, 8 months, the pacifier should be gone.
Yeah.
So let me know
Say
if
say
you need
more.
help. The pacifier needs to be gone by 8 months, 6 to 8 months.
If you go beyond that, say more. What happens?
It may change, depends on the pacifier, but even if it may change the structure of the roof of the mouth, right? Or where the tongue is at. My nephew actually was on a pacifier for I think almost two, and you can definitely see it. He has like that deep bite. Yes, it's structural, it's genetic because my sister has it, but it's also that the pacifier positioning, and sometimes it can put the tongue low and make the tongue tone, which we work on with myofunctional therapy, right? To get the tongue stronger. So from that big fat tongue, you make a skinny tongue, right? So you're working on all of those muscles. So that pacifier can weaken that tongue structure, the muscles. So
Cool.
but if you need help, like let me know. I have great occupational therapists. I have one in New Jersey since we are in Pennsylvania. Be Well OT. Kelsey is the best one in Philly area, Pennsylvania. I love her. And then also in New Jersey, I use Liz, Unlocking Potential, her Instagram tag. I love those two girls. So those are the kids, the babies, they go to them. They also know my functional therapy and they're occupational therapists. So yeah, definitely.
Cool. Tell me more. Like, say somebody comes to you and they're like, "Hey, I have some pain in my face, and I've been to the doctor and they can't figure out. I've been to my dentist. That they gave me mouth guard, didn't help. What are you doing differently?"
So what I do differently is I work on, since I suffered it myself, I have an experience with it. So first of all, I understand what they go through. And I tell them I understand because a lot of them go through doctor to doctor and they get dismissed and they're like, or the worst one is when one doctor told me that I need antidepressive medications or anti-anxiety. I'm like, I'm in chronic pain for the last 15 years. Of course, I'm gonna be anxious and depressed. Like, just help me. So first thing I do is I listen to them and I understand the pain they go through, because I went through the same thing, right? And I use different techniques. So I do my functional therapy, which is helping them breathe through the nose, lips closed, breathe through the nose, working on all of the facial muscles to get them to work for them versus against them, right? So that's my functional therapy, get that tongue where it's supposed to be and to do what it's supposed to. But I also use essential oils. I also send them just like for someone like you to do blood work to figure it out what are their hormonal imbalances are, because hormones play a big role, especially for women, the estrogen progesterone hormones, and as well as cortisol, right? So there's so much things that we can do, because it's not just one thing. It's not just like my functional therapy, do the exercises and you'll be fine. It's also habits. It's also their posture. It's also what they do during the day. That's why many of them have night guards, dental devices. They sleep great. They wake up with no pain, but then doing their whatever they do all day long, right, causes them that pain to come back, because people don't realize how much dysfunction we do, and it's bad habits that we learned either from our parents, from our friends, family, society. Like, we learned all those bad habits and then we keep doing them every day unconsciously, and that affects our whole body until our body's like sends us that text message via symptoms, right? Like, this is not right, you need to change this, you need to find help and fix this, because I don't like this and I'm not going to be able to compensate that long, because that's just too much. So I work on posture, I work on sleep, breathing, and my functional therapy in it. And I do
Do,
guide them to the right people, just like you.
what do those exercises look like? Because when I saw it, I was like, "Oh, this is cool. This is it's not it's not like this crazy thing where like I think it's easy to implement, which I like.
Yes, they're very easy to implement. I'm not a big fan of showing exercises online because then people start to get them and start to do them, and without the guidance, they will do something that they will learn new compensation, let's say. So
Mm,
that's why you will never see on my account. I don't share exercises. I would share something for breathing. I would share something for nervous system, posture, but I will not show exercises. The simple one that everyone can do, that is easy and it's not gonna do any harm, but it will do good, is facial massages. Like I use gua sha. Like, so this is a gua sha tool. So this is for someone who can do a facial massage, and you massage those muscles that are sore. So you will put some oil on, like a serum on your face or lotion, and you massage it. So this is your chewing muscle, and this muscle gets very sore, and it's always one side more sore than another, and they just massage it. Okay. And then, or the inside one as well. So tools like this I love. I also tell my clients to puff up the cheeks if they feel like soreness, if they feel like the muscles are spasming and pushing on their teeth. So just puffing up cheeks like this, or big smile, helps relax those muscles. But we work on the tongue, and we start usually my functional therapy start with tongue to the spot. So our tongue has to stay fully up, not like a strain like this, but kind of like that, how the baby is with breastfeeding, right? So we start first with the tip of the tongue. So, which is a very easy exercise that anyone can do. You can use a Cheerio. I like Cheerios for this exercise. I have elastic band. You put it on the tip of the tongue, and you keep it on that spot.
mm,
And you start with 50 minutes a day. So lips are closed, keep the tongue on the spot. When the tongue hits that spot, you activate parasympathetic nervous system, rest and digest. That's why little kids suck their tongue, because that's a comfort thing for them. They're activating that rest and digest. So if it's a child who sucks their tongue, cheer up with the Cheerio and hold it until the Cheerios melt. So that's a great exercise to do, but it also prevents clenching. There's no way you'll be able to clench your teeth, which many people clench their teeth nowadays. You're not gonna be able to clench your teeth if you keep the tongue on the spot. There's no way. It's harder to do it. So something like that, and then you do it for 15 minutes a day, and then we work on stability. So first we have to separate the tongue and from the jaw, because people who have weak tongue or tongue thrust, someone who tongue is like big and fat, right? Their tongue is weak, so we need to get the tongue skinny, and we need to separate it from the jaw. Why? Because right now in their life, the temporomandibular jaw joint is, and all of the muscles with it, work and compensate for that weak tongue, because we need to chew, we need to swallow. So our jaw is like, okay, the tongue is not doing what it's supposed to do. I'll do the work for it. And it starts doing that. So what we do is we use little clouds, and we start to separate it. So instead of a person doing like this, and if you check, like someone who I was watching, if they have a check like in front of the mirror, if they move tongue to different sides, they will see how the jaw goes with it. So what we do is we stabilize it. So instead of going side to side, the jaw will not move. So the goal is for the jaw not to move. So only the tongue is functioning. So we isolate the muscles, and we work with all of the muscles of the face and neck to isolate them and do what they're supposed to do, because many of the muscles, they compensate. So exercises are super easy. Kids do it. So if kids do it, adults can do it. That's for the lips, to make your lips stronger. A lot of people who are mouth breathers, the lips are very weak. So you work on the lips, and it's just like a bottom with the strength. So it's pretty cool. And then when you work on the breathing, balloons. You blow up a balloon with the hands on your belly to engage the diaphragmatic breathing, and things like that. So it's pretty easy. Exercises are super easy to do with guidance, but tongue to the spot with the cheery or elastic, that's a great one. Puffing up the cheeks or smile. Many people cannot even smile. They just do like one side smile. I was that person. So it's super interesting to look at it.
This is really good. I like the thought of keeping your mouth shut and like keeping the tongue at the at the root at the tip of
Hmm.
your mouth. So this is what I always tell people. Like your breathing should be imperceptible to the viewer. It should be calm. It should be through the nose. And yeah, you want to keep the tongue at the tip of your mouth like throughout the day. So when you said 50 minutes of this keeping your tongue at the roof of your mouth, I was like, man, people should be doing this like
Yeah.
most of the day and at night as well. And I think that's the harder one is the nighttime because people aren't conscious of it. But I imagine you training this and practicing this throughout the day translates into better at
Yes.
nighttime as well.
Yes, it takes about 3 months to 6 months to learn, for the muscles to do what they're supposed to be doing, to work properly. So that's why my program is a little bit longer. My program is always 6 to 8 months with my client because I work on oral facial pain and sleep apnea, which is more complex than just like a regular tongue thrust or something like that. So it's usually like 12 to 14 sessions people get with my functional therapist.
It
Yeah.
sounds like you're walking them through how to
Yes.
different muscles. All right, this exercise working this muscle or the tongue or the lips. Like there's some like each thing you're doing for a reason.
Yes, because the body has to understand what's happening, right? So like the body has to understand, why is this wrong? Like I've been doing this all my life. Why is this wrong? And we have to realize our body is, I don't want to say lazy, but it tries to conserve energy. Like, and it
Yes.
will do stuff automatic. So you have to learn, you have to understand what's wrong. That's why at some point during my sessions, once we get into the proper swallowing, so we learn how to breathe properly, we learn how to use our tongue properly, and then we get into the swallowing, to make sure we swallow using our tongue muscles only, not using our jaw muscles, right? So when we get into that stage of the program, I tell all of my clients, watch other people, like see if they're tongue thrusting, look at the celebrities, look at the way they're breathing, and find the wrong things, like what is dysfunction, what is not supposed to be there. If they're mouth breathing, catch it and just note it to yourself so your brain understands what's good, what's bad. And that way, when we go back, like if something happens, that's why I always follow up with my clients, because life happens, stress happens, right? And it's easier during stress situation, it's easier for us to go back to our bad habits. Again, it's easier for us because it's less energy, right? And I go over I check on them and I'm like, your body will know, because your body already knows what's good, what's bad, right? So when they're drinking and they're using, for example, they took way too much of water into their mouth, right? And they will be using their jaw muscles. They will be like, oh, that should not happen. And they will go back to the proper swallow and they will swallow properly. It's very interesting. It's very interesting. I was my first client, and within, again, I was in severe jaw pain for 15 years. And I worked with the best jaw doctors in New Jersey. No one could help me until 2.5 months into my functional therapy. I realized it was my muscle spasming, and I got rid of that muscle spasming. And after that, I'm like, no way I'm going back to that. Because there's no more pain. You feel great. And it takes a while to learn it, but once you learn it, it's easy.
Is there a lot of maintenance that goes on, or is it more of just these practices of make sure you're keeping your mouth shut, like keeping the tongue at the roof of your mouth,
Exactly.
nose breathing, and then when you do that, you're good. But so you have the exercises to get to that point, and then once
Yeah.
everything is in alignment, then it's more maintenance.
Yeah. So, and then I, like after the program is done, I tell them, I give them certain exercises. So I call them Pilates for the tongue. So there are a few exercises I love. And every person I teach those exercises, and I'm like, once in a while, I want you to go back to that exercise. That's your Pilates for the tongue. That exercise works on every muscle of the tongue. So once you do that exercise, what happens is our muscles have memory. It will remember and it will make sure it does what it's supposed to be doing because it knows it's better for the body, right? So there's certain exercises I do there. Again, they work all of the muscles of the tongue, and it's pretty cool. So yeah, it's not like something they have to do it for the rest of their life. All of the exercises, tongue to the spot and suction, yes, but then you set reminders on your phone, right, or sticky notes throughout the house as a reminder just to keep your lips closed, breathe with your nose, and then tongue up. That's it. And then if you are working on something like some people don't like double chin, right? Their exercise is to work that muscle, and that exercise works on all of the muscles of the tongue. I call it tongue trace, so it's like tracing the back to the back of the tongue.
Those are two things I didn't know. You mentioned the double chin, and the other thing was like fat tongue, and people are just think, oh, I was just born with a fat tongue, and you're
No,
like, no, this is a structural muscular
it's
issue. Like your tongue is weak, and you need to strengthen it, and that's gets rid of that issue.
yes, definitely. Like I have a post on my Instagram and you can see like how fat my tongue was. Like and I was a heavy tongue thruster. I was like every time I would talk, my tongue, you would see my tongue. That's a tongue thrust. That's not supposed to happen. So I always think of our tongue as a tiger in a cage, and the cage is our teeth. So if there's, of course, if there's missing teeth, the tongue will try to escape. The tiger will try to escape, right? So our tongue should not go past the teeth. When you talk, when you swallow, it should not. It always has to hide behind or kind of up. So in the skinny tongue and the fat tongue, that's this. And many people cannot even do that. And they're like, oh my God, I'm not going to be able to do that. And I'm like, wait, and after like second, third session, they come back and they're like, oh my God, look at this tongue. And they get obsessed with this exercise. And what it does, it makes sure that the tongue stays inside of the teeth, right? So it doesn't overflow. And if it doesn't overflow, if the tongue gets skinny, just like any muscle in the body, right? If it gets skinny, it doesn't overflow when you sleep. So it doesn't choke you, it chokes you less. So people who have severe sleep apnea gets better and it goes to moderate sleep apnea, moderate to mild, and so on. So, and the double chin is just like I said. So if you look at that's the normal muscle function, and that's abnormal. So if you look at the abnormal muscle function, the roof of the mouth is that shape, right? But this is the tongue, and this is all the muscle of the tongue, right? So you get the tongue, right? So by gravity, everything goes down, hence the double chin. So if you get the on the roof of the mouth, there will be no double chin. Like
It's so simple.
I never thought about it, but I was like, there's so many people that are skinny, but yet they have double chin. Why do they have double chin? Like, I understand, like, because I gained weight with, right? Like, I understand why but like, why would skinny people have it? And then it's because of the tongue. The tongue goes low, and by gravity, it pushes on here. Because if you touch it here, that's the muscle of the tongue. There's not much, there's like a skin, a little bit of subcutaneous fat, and then that's your tongue. That's a muscle. You can touch it, you can massage it, like you can pinpoint it. So it's pretty interesting. And then I give access. I'm very big on exercises for like facelift and get rid of double chin and everything like that. I'm big on that.
That is such a good sell. Like, oh, get rid of your
Yeah.
double chin without surgery. That is such a
Oh,
good
I should.
sell.
Oh, and I haven't thought about that. I talk to all of my clients about it. I'm like, I give them exercises to get rid of it. I should think about it. Yeah, I should definitely make a post about it.
Yep. No, you'll get a lot of women that way. It's so funny. You were talking about the tongue thrust, and I was like, I know some. Like, I had a picture of someone I know who tongue thrusts, and
Yes.
they have a really fat tongue too. It's so pronounced. When you see someone like that, can you right away by default go, they're probably a dysfunctional sleeper as well? They probably have sleep apnea. Does it correlate like pretty highly?
You would see other symptoms as well. You would see tired eyes, dark circles on the eyes, that posture changes too. So our posture changes. So they have more forward head posture. So they kind of go this way to open that throat to breathe better. So the whole body will be in dysfunction, the whole body. So you will see it. It's not just the tongue thrust as well. And then also we look at the smile. So you're supposed to have a nice wide smile, just like Julia Roberts, Angelina Jolie. You can see all of the back teeth. If you look at my smile, you cannot see my back teeth at all. Do you see?
Mm.
It's like black corridors there. You cannot see my back teeth. I have back teeth, but you see?
I think I have that same issue.
Yeah, so that means that I'm very narrow, so I need that expansion. So what they do nowadays for adults, they expand to help with sleep apnea if someone has sleep apnea.
When you say expand, what are you doing there?
So the roof of the mouth, so they get it bigger. So if you look at my face, so it's wide, wide, and then here it goes smaller, right? So this should be a little bit wider. So every person, so the tongue can fit, right? So if the tongue has no room, how is it going to fit to the roof of the mouth? We can make it skinny, we can make it function better, but some people have such a narrow mouth, right? Such a small mouth that's even though the tongue is skinnier and it's better function, they still don't have enough room to keep it all the way up. It overflows the teeth, the upper teeth. So
And what are they giving you, like an expander or something?
yeah.
And you get it from a dentist, yeah.
So you work with a specialist that does adult expansion. So it's because our suture here never closes. That's the suture that always it can either go this way or this way. That's why when people lose their teeth, right? If you look at older people who have no teeth, their face go down, that frown face, but their jaw gets smaller too. It kind of
Yes.
shrinks because the tongue is not there, and also nothing massages that suture, so nothing expands that suture. That's why when you have a child, when you have a baby and a child until a certain age, you can actually expand it by keeping that tongue there, right? Unless they're severely narrow, then you will need a dentist for it. But with myofunctional therapy, if you teach that baby and a child to keep the tongue up on the roof of the mouth, right, the proper way, how it should be, it will expand and it will do its natural thing with no medications, no alterations, nothing like that. It's very interesting because our tongue shapes the roof of the mouth.
If somebody gets, say they have the expanders, I imagine ideally you'd want to do the like myofunctional therapy along with it because
Yes.
you're changing the structure, so it's going to change the way the muscles work, and you want to be able to support that process.
Exactly. So, because if you do an expansion, if you do orthodontic braces, if you do anything like that, if you don't fix the muscle, that's why, oh my God, I had one person that had 5 times had braces and no one told them that they were a tongue thruster. 5 times. I'm like, are you kidding me? Right? That's like so much money you spend, and why they never looked at your tongue and your muscle function, right? So the teeth either spread or they crowd more, right? And people are like, oh, it's because you didn't wear a retainer. No, I haven't worn my retainer. I had braces. I haven't worn my retainer in 3 years. My teeth did not shift it at all because there's no muscle spasming going on, and there's also no tongue thrust going on. Nothing's pushing on my teeth to change.
Oh,
There's
that's such a good point.
it's like crazy. I keep getting so many people with, so you have to always fix the muscle, right? Either first before expansion, or you can start on that way, they get expanded, and then you can finish my functional therapy. So I would get to the point where I start teaching them how to swallow properly. They get into the expansion, they get their room for that tongue, and then they can finish my functional therapy once they're done with the expansion. Or you can do it together with. It all depends how narrow they are.
In your experience, then, do you feel like retainers are necessary if you go through myofunctional therapy?
Because I'm not a dentist, I cannot tell them not to wear
Okay,
them. But
but
people
what's your
try it.
opinion? This is not like you're
I
telling people to do,
myself
but
haven't worn a retainer. My teeth haven't shifted. I had braces. I took out my braces in 2011. And since then, I wore my retainer every single night because my teeth were shifting. And because I had a surgery done on the roof of my mouth, right? So these two teeth were always going forward because every morning I would remove the retainer, I would live my life during the day, and then I go back to bed and it would hurt here. And it wasn't it was because my tongue was pushing on those front teeth. I realized later with myofunctional therapy that they were going forward because my tongue was constantly doing this. And that's why they were moving forward. So once I stopped the tongue thrust, they stopped moving. That's why they're still straight here. So it's the muscle. That's why I named my company Myo La Vita, muscle. So Myo means muscle, and then La Vita is life. Muscle is life. So muscle is very important in our body because once the muscle starts to spasm and dysfunction, it causes pain and it causes a lot of compensations and issues to the body. So once you treat it, then life becomes easier.
With people who grind their teeth,
Mm-hmm.
I imagine this would help a good bit as well.
Definitely. Because also you have to learn what they do during the day to cause the grinding. So yes, sometimes it's that sleep apnea, sometimes sleep issues with if the airway, sometimes it's stress, bad habits, sleep hygiene, like what they do. It's very interesting. Yeah, but definitely teeth grinding, clenching, grinding, yes. And if you learn to keep your tongue up on the roof of the mouth, teeth are not gonna grind. It's again, try the trick. Whoever's watching, listening, just try the trick, keeping the tongue up, and you will notice how the teeth are not gonna be tense. You're not gonna be able to do this. You're only able to do this if your tongue is down.
Do you have a cue if you're comfortable sharing? If you do, for people when they're sleeping to keep their tongue at the top of their mouth?
That's something they have to learn. That's
Okay.
with myofunctional therapy. Unfortunately, I wish that works. Every time I go to bed, and I always tell my clients is always talk to yourself. Be like, my tongue will stay up on the roof of the mouth. I'm gonna breathe through my nose only. I will keep my lips closed. But I wish that was that easy. You have to train the tongue.
Yes. It's going
Mindset
back
is
to
great, but you can
seriously.
use different tools for sure. I love nasal dilator to open up the nose,
I
or
use those too. Yeah.
mute dilator, right? Lip taping, I would not recommend unless it's cleared by the ear, nose, throat doctor or airway focused dentist if they check to make sure that the person can breathe. If you're sleeping with anything and you remove it in the middle of the night, that means your body's refusing it. Always listen to your body. Your body knows best. There's a reason why it does it, to keep you alive.
That's good. I went to a biological dentist to get some amalgams replaced with composites,
Mm-hmm.
and he could tell that I grind my teeth because he could see the pattern,
Yeah.
and he was like, and his experience was that a lot of times it's people who had braces tend to grind because like you move the bones and now like the body is trying to move them back into the original place,
Yeah.
but my belief about bones is like muscles control bones, which is exactly like what you're teaching as well. Like if you train the muscles properly, the bones will
Yeah.
follow. People try and do it backwards. Like no, we're like when you're a chiropractor and you're like, oh, we're gonna push the bones in place. The muscle will continue to pull it where it's going to go over time. That's why you have to keep going back. But if you train the muscles properly and structurally, there it's gonna take the form and it's gonna maintain it.
Yeah, definitely. I'm same with you because I worked in dentistry for so long, and I worked with different doctors, and they were fighting the bone. Like they were, and if like they were always looking at the bone, and our teeth is bone too,
Yes.
right? So they were looking at the teeth, they were looking at the jaw, they were not looking at the muscle. Like again, I was in it for so long, and I'm like, when they told me about muscle, I was like, what do you mean? We look at the muscles, and they're like, no, function of the muscle. I'm like, whoa. Like it changed my whole life, literally, like changed my whole life because it got me out of pain, but it also changed my whole life because it opened a rabbit hole for me that I got in. And it's just so much like if your jaw muscles are tight and they push on your bone, which is your teeth, you are unable to move your neck. That's why people are unable to turn to the right and left. And if they're unable to see what's behind them, if there's a tiger chasing, if there's danger behind them, if they're unable to see it, right? What's going to happen? Their body's going to be in a fight or flight response. The body's always going to be in anxiety, right? And then it's crazy. And it's muscle. It's all because of muscle spasming, pushing on that spine, pushing on the teeth, pushing on all of the bones. It's insane. I just wish like everyone was talking about it.
What's wild to me is you have a problem that's originating from the muscles in your mouth and your jaw and your lips, and it has so many downstream effects of other parts of the body. It's like you're saying, it affects your posture. You get an anterior head carriage, which can create neck pain, or you start affecting one part of the spine, it affects the full chain. So I mean, this has much far-reaching effects than I think people realize. So like we're doing here is like getting to the root of a lot of these issues, whether
Yeah.
it's dental, structural, and you're going like, okay, let's fix this, and you'd be surprised at how many other things are going to be resolved as a byproduct of it's a
Exactly.
very, very, like you said, very simple exercises. Like that's what blows me away. Is like this is it's not you're not going to a dentist or an orthodontist and like spending a ton of money on like a procedure or surgery. Like it's safe, it's simple. Like it's some of these are look fun,
Yeah.
and it's you're talking about like 6 months of time. It's not like a ton of
Yeah.
investment. So it's
Yeah.
I wish more people just knew about this because it's wild.
It is wild, like just to understand it and see how it works. And it's like, again, no medications. I work mostly virtually. So it's something, it's kind of like a personal trainer for your face and head and neck muscles. Like you just learn what you're supposed to be doing originally. And unfortunately, it's very common that a lot of people have this muscle dysfunction and they don't even think about it, right? Until they find someone that works with it.
Do you have any experience or do you know anyone who's worked with like singers, like people who use their face a lot? And like, is there a tie there? Like, can it improve people who like sing?
So
Like, what is that?
yes, definitely. Because if the tongue stays up on the roof of the mouth, and if the tongue is able to do all of the functions it's supposed to do, a lot of things with speech get corrected, like lisp and other things, right? Pronunciation. So things like that. But with sinners, what is very interesting is I get them frequently, and even in the dental chair, when I was a hygienist, I would look into their mouth. You could really see back of their throat. So they would rarely have like severe sleep apnea because they're always sinning. And that works the soft palate muscles, your throat muscles. Their throat muscles are so exercised and so good. So that's a good point because that's a great exercise to do. It's just sinning. And it actually promotes good vagus tone. So it's an exercise for the vagus nerve as well.
Yes.
So it's amazing to do, but yeah, definitely because if the tongue does what it's supposed to do, the function of it is properly functioning, then yeah, it can help a lot. But sinners have a really good muscle tone of their soft palate, the uvula. I love seeing that. I'm like, oh my God, like you can really like it's nice and open. It's pretty cool.
When you see a singer's throat, will you ask them? You'd be like, "Are you a singer?"
Yes,
Yeah.
always. Especially like opera singers. Oh my God. Like
Oh, they're
again,
wild.
and yeah, wild. In dental chair, I was like, I can like see like inside like your lungs. Like that's how like it's very good muscle tone. Like amazing. Amazing.
That's cool. I like that kind of stuff where
Yeah.
you can.
I love that kind of stuff
That's cool.
too.
Right on. Well, yeah, this is a good time to wrap. But I do want so anybody, so you work virtually, so whether throughout the world you work with people. How do people find you? How do they get in contact with you? What's the best way?
So the best way is my website. So if you go on myolavida.com, if you go on my website, you can book a consultation with me. I always start with a consultation and then I see how I can help you. So if I can help you after consultation, I schedule an evaluation visit, which is about 90 minutes visit to get to the root cause of the dysfunction. So everything is on my website. It's very easy to schedule for that. I am trying to be active on social media. So Instagram is my favorite. platform to be active most on. So Instagram as well.
And it's Myo on
Maya
Instagram.
Lavita. Everything is Maya Lavita.
Cool. And then it's like teenagers and up for the most part that you work with?
Yes, so I do see 12 and up. Anyone can contact me. I always have on my website too. If you have any questions about anything for your child, for your baby, just email me, message me, and I will find the practitioner close to you who will help. For kids under age of 6, it would be beneficial if they see someone in person. And then also they need like a more of a team. They need a myofunctional therapist. Some of them need speech therapists. Some of them need occupational therapists. Some of them need feeding. So it's just more, involved. Definitely.
Cool.
But definitely they can contact. I'll be able to help you. Again, I was that child that suffered from sleep apnea, so I would love to help anyone. Doesn't matter what age they are. I will guide you to get the help you need and guide you to someone who will listen to your concerns and understand what you go through.
Yeah, I imagine there's a lot of people with kids where they're suffering and they don't quite know what's going on or why they have trouble sleeping or why they have pain, and they're going to all these specialists. So to have someone who can help navigate that would be super useful.
Yeah, definitely.
Cool. Well, this has been great. MyoLavita.com if you want to get in contact with Vita here. MyoLavita on Instagram, and then otherwise, if you are following this, if you're on my email list, I'm going to be posting this as a replay as well, so you'll be able to see it if you missed it. But this was so cool. I am excited to be able to share this with so many people.
Thank you, Jon.
Yeah, hopefully this changes a lot of people's lives, because I want it to happen with you, and I know there's a lot of other success stories out there.
Yes.
Cool.
Thank you so much.
Cool. Thanks for joining. I appreciate it.